All right, so something that we're going to talk about right quick before we lay her down is what we call pursed lip breathing. You may have heard the term utilized before, but essentially what it is, it's a technique we can choose to teach the patient, painless, easy to perform and easy to learn, to drive their respiratory rate down if they're dyspneic, if they're feeling like very, very dyspneic during activity, if they're breathing really, really fast, help them relax, improve ventilation. Essentially, the way that it works is we instruct the patient to, during exhalation, to pretend like they're blowing out a candle, right? We use a lot of these visual kind of cues in order for the patient to understand what we're talking about. And I'll explain to you why that's important in just a second. So essentially, I want you just to breathe in normally, just relax. Good. Your own pace. Now, don't do anything until I tell you to, but when I tell you to, when you breathe out, you're going to breathe in normally, and when you breathe out, you're going to pretend like you're blowing out a birthday candle. All right, now she's doing it perfectly because she knows how to do it. Patients are going to do a few different things. Exactly, they're going to forcefully do that, and we want to make sure that we explain them. It's not forceful. It's just kind of a long exhalation by pursing those lips. Something else that they always tend to do is blowing up those cheeks, right? We don't want them to blow their cheeks out. Keep those cheeks nice and tight, lips tight, and just exhale with pursed lips. For those of you who are long distance runners or athletes, you may have used this technique in the past not knowing exactly what it does. We'll talk about positive expiratory pressure this afternoon, but essentially that's what it's providing. It's allowing the airways to stay open longer in order for gases to move through the membranes a little bit better for them to actually feel like they're catching their breath. Great technique during any exercise, when they're feeling like they need to drive the respiratory rate down, if they're feeling anxious during walking, any of the sort.
And also to help with people's chest deflation and COPD, because it helps maintain the integrity of the alveoli as people are breathing out. So basically, instead of having alveolar collapse with this expiratory pressure that Eder was talking about, we're able to maintain those alveoli open so they don't collapse and trap air. So it helps the patient to be able to have less air trapping and therefore reduce the amount of CO2 that they're retaining, which is important in patients with COPD. It's also important too in patients with restrictive disease to help them slow their respiratory rate. A lot of times what you'll see is they'll get more and more dyspneic as they do more and more activity. So using some pacing and some pursed lip breathing with patients with restrictive disease can help them slow their breathing and help them to better accomplish their ADLs.
Absolutely. And notice how she said that they can do some pacing and pursed lip breathing. The reason why I'm emphasizing that is because, as I talked last week, we're going to teach about 300 things that we can do. It is up to you as a clinician to teach them what's more important, and you can mix them up if they do fit together, okay? It's fine. There isn't one answer for every single patient. Two other things we're going to work on here right now, so we're going to lie her down in just a second, is a facilitation of kind of the exhalation to kind of get some air out, and also some segmental breathing exercises. So I have a wedge back here again just for comfort. Again, wedge or hospital bed or anything of the sort. And place your patient in a position where they're comfortable and they're breathing nice and easy. So I want you to relax. And actually, I want your hands on your side. Once again, we always tell our patients when and where we're going to place our hands, right? So I want you to just relax and breathe at your normal rate. Essentially, what I'm going to help you do here in just a little bit is get some of that air that is having difficulty coming out of your lungs. This is great for your COPD patients, your kind of, CO2 retainers, the blue blowers we talked about, they have those big lungs that you can't get that air out, increased residual volume. Let's help them get that air out. So essentially, I'm not going to do anything just yet. I'm going to place my hands on your rib cage here in just a second. And when you breathe out, and I'll tell you when I'm going to do it, I'm just going to give your kind of rib cage a little bit of a squeeze. It should be painless. If I'm squeezing too hard, just let me know. I'm going to place my hands on your rib cage. I'm going to find this kind of lower claustrophrenic angles on here. I'm not applying any resistance just yet. Just breathe normally. And I want you to take a big deep breath in as big as you can, and then breathe out. And my pressure is going to go under the rib cage medially and kind of superiorly to kind of push some of that air out. We can do that as many repetitions as we feel necessary until the patient maybe feels a little bit better, they feel less short of breath. I always do it at least like 10 breaths, but I make sure I tell the patient, breathe at your own pace, because when they're performing for you, they'll start breathing really fast. So again, instructions. Breathe in as big as you can, and then out. I'm just gonna give you a little bit of pressure here. Awesome. Perfect.
And what's happening is I'm getting a passive outflow of air as he's pushing in.
Correct. If you are able to try it with partners or anything like that, or when we're able to try it together, you'll feel it, how we can actually get some air out. It actually is a mechanical way of getting some air out via some strength. Now, we talked a little bit about kind of breathing into the patient's hand or into the therapist's hand. Something else that we can do is what's called segmental breathing. Segmental breathing is breathing, allowing segments of the lungs that are not working properly, they're maybe deflated, they have collapsed, to start reinflating. If we start making any compensatory movements with our body because, I don't know, the great toe doesn't have a lot of extension, we're going to keep walking in a certain way. If the lungs are not working well also, we're going to see some compensatory kind of changes. So for example, this right side is not working really well on her. You can see it by her slouch when she breathes. Her rib cage isn't really rising. We have auscultated. Maybe we've heard some diminished breath sounds. So essentially, we're going to attack, quote unquote, that segment by same thing, placing our hands where we feel the impairment is. And I want you to just relax. And you feel my hand back here, this one, my right hand. And I want you to just do your very best. I know it might be difficult to breathe into my hand, so inflate it as much as you can. Good. And then relax. No resistance here. Breathe in as big as you can to my hand, and then relax.
And he's doing a little bit of shaking to help facilitate the musculature.
Sure, like a tactile cue, and yes, you can't see that, so thank you for sharing that. It's just a really good tactile cue for patients. Breathe into my hand, good, right here, right here. Now make sure you kind of have that progression though. We've observed the posture, we've observed her breathing, we have auscultated, and we have confirmed that there are diminished breath sounds there. So let's go ahead and work on that area, or that segment.
And this is really good when you have a patient who has hemiparesis on one side. A lot of times they will have some decreased chest wall movement on their hemiparetic side. So this allows them to kind of get some air into this. This can also help your patients with hemiparesis develop some trunk control and also develop some control over their intercostal muscles as they're breathing in.